Welcome to this deep dive. Today we're tackling a really important topic for many of you, managing vascular disease.
That's right. And specifically, we're going to look at the medications involved, particularly a class of drugs called statins.
Exactly. So many people might have questions, maybe some concerns about these. If you've got a vascular condition or you're just trying to understand more, well, hopefully we can help.
Our plan today is to explore how statins fit into treating peripheral arterial disease, coronary artery disease, and also cerebrovascular disease.
And we absolutely want to address those common worries, things like side effects, and what happens if, maybe statins aren't the right fit for someone.
And we've grounded this in some solid sources, medical guides on the vascular system, vascular surgery, biology, and clinical practice guidelines, too.
Great. So let's start with the basics, maybe. What exactly is vascular disease?
Good place to start. So basically, it affects your arteries and veins, the whole network carrying blood around your body. And when these blood vessels get narrowed or damaged, well, that can lead to problems in different areas.
And we're focusing on three main types today.
Yeah, exactly. First, there's peripheral arterial disease. That's when the arteries outside your heart and brain get narrowed. Think legs, mostly.
Right, like causing leg pain when walking sometimes.
That can be a symptom, yes. Calf claudication. Then second, coronary artery disease. That's the narrowing of arteries supplying the heart itself.
The ones that can lead to heart attacks.
Precisely. And third is cerebrovascular disease. This affects the arteries going to and inside the brain.
Which is linked to strokes, unfortunately.
Yes, that's the major risk there.
So someone gets diagnosed with one of these, and very often the conversation turns to statins. People wonder, what do they actually do? Do they work? What if I have a problem with them?
Absolutely valid questions. Let's dive into what our sources say, starting maybe with peripheral arterial disease. Well, there's some really compelling evidence here. A big study, the Heart Protection Study Collaborative, HPSC for short, but we'll try to avoid acronyms.
Right.
It looked at over 20,000 people. Many had peripheral arterial disease plus other risk factors.
Wow, that's a lot of people.
It really is. They studied a specific statin, simvastatin, and its effect on, well, vascular outcomes.
And what did they find?
They found pretty substantial evidence that lowering cholesterol benefits this group. It really highlights how important that low-density lipoprotein cholesterol, the bad cholesterol, is in driving atherosclerosis in those leg arteries.
Okay, so atherosclerosis.
Yeah.
That's the plaque buildup, right? Fatty stuff in the artery walls.
Exactly. It's that buildup, cholesterol mostly, plus inflammation, that leads to these plaques that harden and narrow the arteries, cutting down blood flow.
So statins help by lowering that bad cholesterol.
That seems to be the key mechanism. By reducing those low-density lipoprotein levels, statins likely slow down plaque formation, which in turn lowers the risk of, vascular events in the legs and feet.
That makes sense. And you mentioned other studies, too.
Yes. Another one by Secow and colleagues showed better 5-year survival rates for patients who had really severe peripheral arterial disease, something called critical limb ischemia.
That sounds serious.
It is. It's when blood flow is so poor it threatens the limb. These patients had bypass surgery on their legs, and those who also got statin therapy did better long-term.
Improved survival is a pretty significant outcome.
Absolutely. And there's more, actually. Looking at data from a large registry called CRITISH, which tracks patients with that same critical limb ischemia,
Okay.
researchers, Stavroulakis and colleagues, found a link between patients on statins and better amputation-free survival, so keeping their limb and surviving longer.
Wow. So strong evidence for peripheral arterial disease. What about the heart coronary artery disease? Our sources didn't focus specifically on trials there, did they?
Not these specific sources, no. But the underlying biology is key here. We know from vascular biology principles that cholesterol is a primary driver of atherosclerosis in the heart's arteries, too.
So it stands to reason.
Exactly. It stands to reason that statins, by lowering that cholesterol, would be crucial for managing coronary artery disease as well. It's a well-established part of treatment guidelines, even if not detailed in these particular readings.
Right. The mechanism is the same, just a different location.
Precisely. That atherosclerotic process, it doesn't really care if it's in your leg artery or your heart artery or leading to your brain.
Which brings us to cerebrovascular disease. Again, not the main focus for statins in these specific texts, but the implication is there.
It is implied, yes. The overall benefit of statins for artery health suggests they'd positively impact the arteries supplying the brain, likely helping to reduce stroke risk by tackling that same underlying atherosclerosis.
Okay, so it really seems like statins play a broad, important role across different types of vascular disease.
It certainly looks that way based on the evidence and understanding of the disease process.
But as we said, people do have concerns. Let's talk about those potential downsides or worries.
Absolutely essential to address that. It's totally normal to have questions about any long-term medication.
What are the common things people worry about? Side effects.
Side effects are definitely a big one. Now, our specific sources today didn't list them all out, but from general medical knowledge, some people do experience things. Muscle pain or weakness is probably the most commonly discussed one.
Right, I've heard people mention that.
Yeah. And sometimes digestive issues like nausea or gas might occur. Also, doctors monitor liver function with blood tests, as statins can occasionally cause changes there.
So it's not like everyone gets these.
Oh, definitely not. Many people tolerate statins very well with no issues at all, but it's vital, really vital to talk to your doctor if you do notice anything unusual or concerning.
Don't just stop taking it, right? Talk first.
Please, yes, talk first. Often, side effects might be mild, or maybe switching to a different statin or adjusting the dose could help, but the doctor needs to know.
Okay, that communication piece is crucial. But what if someone genuinely can't tolerate statins? Maybe they've tried different ones, and the side effects are just too much. Are there other options?
That's a really important point, and yes, there are alternatives. While our sources for this deep dive didn't detail them, it's good for listeners to know other treatments exist for managing cholesterol and vascular risk.
Like what kind of things?
Well, there's a medication called ezetimibe. It works differently, reducing cholesterol absorption from your food in the gut.
Okay.
And then there's a newer class, PCSK9 inhibitors. These are injections usually given every few weeks or once a month. They're very powerful at lowering that bad, low-density lipoprotein cholesterol.
Injections, okay, so more involved than a daily pill.
A bit, yes. And they tend to be more expensive, so they're often used for people at very high risk or those who truly can't manage with statins or ezetimibe.
So options exist, but it really depends on the individual situation.
Absolutely. It requires a detailed chat with the doctor, considering the person's overall health, their specific risks, what they've tried before, tolerance. All of that goes into deciding the best path forward if statins aren't working out.
Got it. So statins are important, maybe alternatives exist, but this isn't just about pills, is it? Managing vascular disease is broader.
Oh, completely. Medication is often just one piece of the puzzle, a very important piece, often, but still just one part.
What else is involved? Lifestyle seems key.
Hugely key. Our sources, especially the ones talking about surgery or catheter procedures, consistently emphasize lifestyle. Things like eating a heart-healthy diet.
Right. Less saturated fat, more fruits, vegetables.
Exactly. And stopping smoking. That comes up again and again as a massive risk factor for all types of vascular disease. Quitting is critical.
And exercise.
Regular physical activity, definitely, within the person's ability, of course. It helps with weight, blood pressure, cholesterol, overall circulation.
And sometimes, lifestyle and medication aren't enough. Our sources mention procedures too.
Yes. For more severe blockages, sometimes interventions are needed to physically open up the arteries. This could be surgery, like a bypass operation where they reroute blood flow around a blockage.
Okay.
Or it could be what we call endovascular procedures, things done through catheters, like angioplasty, where a small balloon widens the artery, often followed by placing a stent, a little mesh tube, to keep it open.
So it's a whole toolkit, really. Lifestyle, medications like statins or alternatives, and sometimes procedures.
That's the holistic approach, yes. It has to be tailored to the individual.
Okay, so let's try and wrap this up for everyone listening. What are the main takeaways here?
Well, I think first, it's clear that statins are generally considered really crucial medications for managing vascular disease in different parts of the body.
By tackling that core issue of cholesterol buildup, the atherosclerosis.
Precisely. And there's good evidence behind their use, particularly highlighted today in peripheral arterial disease.
But, and this is a big thing, but concerns about side effects are real and valid.
Absolutely. And the key is open communication with your doctor. Don't ignore side effects, discuss them.
And know that if statins truly aren't tolerable, other medication options do exist alongside that essential foundation of lifestyle changes.
Yes, remember, medication is part of a bigger picture that includes diet, exercise, not smoking, and maybe procedures if needed.
It's a partnership with your healthcare team.
Definitely.
So a final thought to leave people with. We've talked about statins and current approaches, but medicine is always evolving, isn't it?
It really is. Research is constantly giving us a better understanding of vascular disease.
So looking ahead, what kind of new therapies or strategies might emerge? Maybe things that work differently than statins or target other aspects of the disease.
That's the exciting question, isn't it? Perhaps targeting inflammation more directly, or finding ways to help arteries heal, or even more personalized approaches based on genetics. It's an active area of research.
Something to keep an eye on, and definitely something to keep discussing with your doctor, making sure your treatment stays current with the latest understanding.
Couldn't agree more. Stay informed, stay engaged in your care.